Vice President Yemi Osibanjo recommend fervent prayers to overcome challenges facing the country. Federal government restates position, says Nigeria remains indivisible. Plus, correspondent takes a look at measures put in place to avoid the spread of cholera in the state. Hello, this is Panorama reaching you live from the NTA Enugu Network Center. I am Chinenye Ngui. Vice President Yemi Osibanjo says the country requires fervent prayers to overcome its challenges. This was at the National Conference and Retreat of Catholic Women Organization of Nigeria in Jos. Ndeyang Adeyaba Yang reports.
The conference by the National Catholic Women Organization is themed, Let's Think with the Heart of Mary. Vice President Yemi Osibanjo, representative, says societal ills have greatly affected the socio-economic growth of the country, expressing optimism that with fervent prayers and unalloyed support, Nigeria will overcome all challenges.
Preserving the fabric of our society requires people of faith and goodwill to come together for the common good and to strengthen the bonds of community. Only by pulling together we can, as a people, pull through adversities.
Prayer have its place, and these are beautiful prayers.
Governor Simon Lalong, represented, notes that peace is a cardinal pillar of the nation's development. As such, the conference is expected to consolidate government's effort in peace building.
The heart of Mary is an embodiment of humility, an embodiment of the solution to God. I'm sure if Catholic women alone in Nigeria would act with the heart of Mary, Nigeria will change.
Goodwill messages centered on the need for continuous collaboration, dialogue, and prayers for the growth of the nation. In Jos, Nigerian and the Abuja, NTA News.
The federal government has restated its position, saying Nigeria remains an indivisible country. Information and Culture Minister Mohammed restated this at a book launch in Abuja. Anthony Forson reports.
Chairman's opening remarks through the chairlady's speech up to the keynote address and that of the guest of honor, the indivisibility of Nigeria remained a recurring statement.
That also shows that tolerance, understanding is what we need as a country. So thank you, Dr. Gumbi, for demonstrating that we can live together happily if we are committed.
A life of value is one in which achievements are honestly earned and are hardly flaunted, but are rather deployed, not just for self-advancement, but also as platforms to serve.
But the more interesting and necessary for our time is his mentoring skills. I believe we need mentoring very much at this time in our lives, because a lot of our young ones are moving like sheep without shepherd because they do not know that some of the dignitaries here had passed through very difficult times to get to where they are.
Information and Culture Minister Mohammed, before unveiling the book, was in agreement with the speakers.
One thing that has come out clearly in all the speeches and in all the presentation is that Nigeria is a great country, and that we should strive to overcome the very few differences and understand one another and make this country even greater. My honor to present the book to you. Somebody else is going to learn if you have money. I don't have money.
The book, Ripples of Grace, is a 13-chapter book that presents the genealogy, deeds, and consequences together with the intention of same for Dr. Bamigboye Ogumbi. In Abuja, Anthony Forson, NTA News.
Emir of Katsina, Abdulmuminu Kabir Usman, has called on Nigerians to live together in peace and harmony, irrespective of their differences in tribe, ethnicity, and religion. The Emir was speaking during the visit of Igbo residents in Katsina. Dauda Mohammed reports.
The visit by Igbo Residents Association in Katsina State is a show of brotherliness and support to the untiring efforts of the Emir of Katsina, Abdulmumin Kabir Usman, in fostering peace and inclusiveness to the various tribes and groups residing in his domain. Emir Abdulmumin Kabir Usman, while expressing his appreciation for the visit, commended the Igbo community in Katsina for their peaceful disposition and entrepreneurship skills that encourage business activities in the emirate. Leader of Igbo Residents Association in Katsina, Charles Ahanonu, described their visit as a solemn homage, adding that with the support of the Emir of Katsina, the Igbo community has been living and doing business peacefully in the state.
We don't have anything to say rather than thank you. We pray to God that has put us under you to grant you all your heart desires.
The Igbo community assured of their support to the Emir at all times. In Katsina, Dauda Mohammed, NTA News.
The Nigerian army has reacted to a doctored video footage allegedly released by secessionists featuring blood images of some persons dressed in green camouflage destroying a farmland in an undisclosed location. A statement by the Director, Army Public Relations, Brigadier General Onyema Nwachukwu, says the fake video is an attempt by unpatriotic Nigerians to tarnish the image of the Nigerian army. Brigadier General Onyema enjoined members of the public to be wary of such negative propaganda materials by subjecting them to thorough scrutiny. The Bauchi State Primary Healthcare Development Agency has commenced the first dose of vaccination against cholera, targeting 750,000 residents of Bauchi local government area. Bulak Afsa reports that the measure is aimed at reducing the spread of the disease that recently claimed many lives in the state.
Bauchi State is one out of the 18 states in the country fighting cholera, and 19 out of the 20 local governments in the state are affected, with Bauchi local government being the worst hit. Hence, the vaccines will be administered in 16 wards out of the 20 wards of Bauchi local government area. Chairman of the State Primary Healthcare Development Agency, Dr. Mohammed, reminded residents that the vaccine is no replacement for preventive measures. Hence, residents should avoid open defecation, wash their hands regularly, and step up their personal and environmental hygiene.
Outbreak of cholera in Bauchi is alarming. It involves all the 19 local governments, except one local government, which is Emir. They gave us 1.5 million doses of vaccines, which is first and second dose to be given to children, 1 year, and all the adults.
In their separate remarks, representative of the World Health Organization, Goni Abba Ngala, and representative of Medicine Sans Frontiers, Switzerland, Chikudi Nsudi, reminded residents that the vaccine is important in fighting cholera. The exercise is expected to last for 5 days in Bauchi. Bulak Afsa, NTA News.
In view of the recent cholera outbreak in Enugu State, an emergency response team and center to avoid the spread of the disease have been constituted. The Executive Secretary, Enugu State Primary Healthcare Development Agency, Dr. George Ugu, was speaking while giving an update on the outbreak. Chika Ugu reports.
Since cholera outbreak, which claimed about 18 lives in Enugu and 2 persons presently in hospital, has prompted an immediate response by the Enugu State healthcare system. According to the Executive Secretary, Enugu State Primary Health Care Development Agency, 3 new special emergency treatment centers have been established to contain the number of infected victims, with ongoing training of health workers at the various centers to acquaint them of the safety guidelines to ensure that the disease is contained.
We're expanding capacity in those centers, getting more health workers to work there, and also providing the necessary infusions, the drips, and all the things we need to resuscitate them.
There is currently ongoing sensitization in the media, while the healthcare system also went a step further to paste safety guidelines in strategic places around the affected markets.
You know, say this market, some disease enter our market, and the people we are making business with them, and some people run, go out.
Mostly in densely populated and poor sanitation areas, he urged people to take precautionary measures by ensuring that their environments are clean and to use clean water to wash utensils, hands, face, and teeth to avoid contracting the disease. In Enugu, Chika Ugu, NTA News.
And that report forms our background for discussion today on Panorama. And with me in the studio to expand the discourse is the Executive Secretary, Enugu State Primary Healthcare Development Agency, Dr. George Ugu. Doctor, you're welcome to Panorama.
Thank you. Good afternoon, viewers.
You're welcome. Is cholera a bacterial disease or viral disease? And what are the symptoms associated with this disease?
Cholera is a bacterial disease that is transmitted through the fecal-oral route. That means from, it gets out from what we have excreted and finds its way through our mouth. And the main symptoms associated with it is vomiting, which is associated with passage of watery stool. Frequent passage of watery stool and vomiting are the key symptoms. And so that's why it quickly makes the quantity of water and fluid and also some sensitive components called electrolytes to go down in the body, making the person weak.
So how is cholera contracted, and what is the mode of transmission?
Yes, that's why I said it's fecal-oral. That means from contaminated water, it gets into the body and start causing all these symptoms. And fecal meaning that it is excreted from our body when we pass physics. And then that physics will go into the water, and then if you take the water, you take the microorganism, the bacteria that will now cause the disease.
Okay, Doc, since the news of the cholera outbreak at the cattle market in Enugu broke out, what is the number of deaths recorded? And aside those that passed on, what of those that were hit by this disease who were rushed to the hospital? Have they recovered?
There was a swift response from the Enugu State Emergency Response Team. Government and our governor is healthcare loving. It was very swift. It's just that it sneaked in somehow, and the health-seeking behavior of the Badberry community was not as good as we wanted. But immediately, the first time it came, we responded swiftly. In the state, we've lost a total of 13 persons to this outbreak, and several persons that had it. But we quickly moved all of them to treatment centers, and they are all recovering well now. Many have gone home. We included even private hospitals that were around there, and primary healthcare centers that were around there, and also involved the severe ones were treated in a teaching hospital. And that is why the outcome was a bit better.
Okay, now let's talk about treatment. How do you treat patients with cholera?
The cornerstone, the key aspect of treatment with patients with cholera is to replace fluid. That means to rehydrate the person, and that's often, it's replace electrolytes. So that's now the kind of fluid we use. So we replace fluid quickly, very quickly, because fluid and electrolytes are lost fast. And again, those who have mild disease, you may not even need to give them drips to replace that fluid. You can just give them oral rehydration solution, and that will make them to take back the fluid they are losing and also the electrolyte that they are losing. So it's actually not so difficult to treat, but the person should present to hospital very early to enable this treatment to be effective.
So what happens to people with severe cholera if they are left untreated? What happens to such persons?
It can quickly lead to death. As simple as that vomiting and stooling may be, if it is not arrested and nothing is done, the person will lose so much fluid and also electrolyte, and the person will become very weak and can die. In the severest of form, without treatment, the person can die. And that's why you hear sometimes it is even the deaths in the community that alerts the entire system that there is cholera, which shouldn't be. Because people who have passage of water stool should report to the nearest health facility for urgent attention. And that way we can pick it up even earlier. And so we don't need to wait until someone dies or until someone is very weak and unconscious. Anytime there is passage of water stool, let us take it a little more seriously.
Okay, Doc, we visited that particular cattle market in Enugu.
That was kind of you.
Yes,
we have been there severally.
And we saw that that market is really in a poor sanitary condition. So what measures have been put in place in that market and in the state to avoid the spread of this disease?
Yes, it has been a battle, but somehow I think we are on the winning side. With the first angle we went, immediately we finished relocating and moving those who are ill, was to begin to educate the community, begin to tell them what they should know and how they should handle their sanitary condition. And also we had to quickly establish within that market what we call an emergency treatment center and triage center. That is where we sort out even the mild one, the severe one, so that the severe one we move you straight to hospital, the mild one we give you oral rehydration solution and also some health education. That's what we'll be doing there. When we're discussing and improving the sanitary situation there, water practices, water supply, and also trying to spread them out the way they should be. Because you know, when you have people clustered in the same place, probably dirty environment and all that, that is what gives this disease room to start festering.
Okay, now finally, on prevention, what would be your advice to Enugu residents in terms of keeping the personal and environmental hygiene, especially now that there is a third wave of the COVID-19?
Well, you see, this period is not the easiest of time when it comes to illnesses. You could see in these last few months, we are battling with COVID, yellow fever came and was controlled quickly. Cholera has now come and is being controlled. So it's a challenging period. I think we have to be more health conscious. If we can look at the examples that our governor has been giving, always practicing all the preventive measures that he's told to prevent, taking his vaccines accordingly, and also putting us that are in the health sector on the edge to do the right things. The citizens should now take a cue from that and be conscious of our environment in terms of health. We should be in a clean environment. We should avoid open defecation. And we should also try to look at the water we are taking. Like you are seeing this cholera now. Yeah. In terms of cholera, we should take water that is clean, that is potable. If we don't have that, we should boil whichever one that is near us to make it a little safer. Okay, we should also wash our hands and our food and vegetables very well before we eat them. These are important tips that we need to apply. Thank you so much, Doctor.
Let's leave it here for now, sir.
Thank you very much.
Thank you so much for sharing your thoughts with us on Panorama. I've been speaking with the Executive Secretary, Enugu State Primary Healthcare Development Agency, Dr. George Ugu. And we'll take a break here. Panorama continues in a moment. And now to COVID-19 update. The latest release from the Nigeria Center for Disease Control, NCDC, shows that there are 272 confirmed new cases of COVID-19 in the country. This number, recorded from 9 states, brings the total number of confirmed cases to 170,895. In the breakdown of figures, Lagos is leading the chart with 182 cases, followed by Rivers State with 34 cases. Ondo has 24 cases, Oyo 10, Abia and Ogun State 7 cases each, Ekiti 5, Delta 2, and Plateau 1 case. The total number of confirmed cases is now 170,895. The total number of persons discharged, 164,788, and 2,132 deaths, sadly. Misinformation over a tire burst of an aircraft while tasking at the Ilorin International Airport has generated panic, with information going round that it was a plane crash. The tire burst on the tarmac put activities at the airport on standstill for more than 24 hours. Aisha Abubakar Yahaya has the details.
This is Ilorin International Airport, where it was rumored that a plane crashed. Although the Federal Airport Authority of Nigeria confirmed an incident
that occurred at 10 a.m. on Friday, 23rd of this month, involving Airpeace B73750, in which the plane had a burst tire on landing roll, but all the 66 passengers and 6 crew on board were disembarked without any issue. The head of corporate affairs, Ilorin International Airport, Adeye Oluwaluwa Kayode, said the aircraft was given prompt attention, leaving no room for fear.
No crash. Nothing happened to any of the passengers. Every passenger was held and healthy. Everybody alighted from the aircraft safely and peacefully, and they left and they departed. I can tell you this morning that Airpeace have departed this morning, and they are still coming back. They are going to do 2 flights in and out, both Abuja and Lagos, from what I heard.
Meanwhile, the Accident Investigation Bureau, in a statement confirming the incident, said the Bureau decided not to investigate the incident as a tire burst is one of the few issues of an aircraft that has to be dealt with once in a while. As at the time NTA News was at the airport on Sunday morning, airport premises was full with people boarding from Ilorin to Abuja, while an aircraft was also landing to pick up passengers. The Federal Airport Authority of Nigeria therefore debunked the rumor of a plane crash in Ilorin International Airport, as no such incident happened, and called on Nigerians, especially media organizations, to always verify information in order not to misinform the general public. Aisha Abubakar Yahaya, NTA News.
Federal government has approved the extension of deadline for the NIN SIM data verification to 31st October 2021. A joint statement by the head corporate communications of NIMC, Kayode Adegoke, and Director, Public Affairs, NCC, Ikechukwu Adinde, tells that the decision to extend the deadline was made following a request by stakeholders to accommodate registration in hard-to-reach remote areas, foreigners and diplomatic missions, diaspora, and address low enrollments in schools and hospitals, as evidenced by enrollment statistics. It also follows a review to the progress of the exercise, which indicates significant progress, hence the need to consolidate the gains of the enrollment and NIN SIM verification process across the country. As of July 24, 2021, there are over 5,500 enrollment systems within and outside the country, and this would significantly ease the NIN enrollment process and subsequent linkage of NIN to SIM. There is now a total of 59.8 million unique NIN enrollments, with average of 3 to 4 SIMs per NIN. With a great number of enrollment centers within and outside the country, and many more coming up, every citizen, legal resident, and Nigerian citizens living in diaspora should be able to obtain their NINs. The statement adds that the federal government is also excited that the use of NIN in the process of the Joint Admissions and Matriculations Board (JAMB) exam significantly reduced the challenges of exam malpractice, and urges those yet to comply to take advantage of the latest extension. And for sports updates, let's now join Olalekon Kelajolu.
Nigeria's senior men's basketball team, the Tigers, lost its first match of the ongoing Tokyo 2020 Olympics by 84 to 65 points to Australia. The Tigers started with a 23-23 point score in the first